If you ever felt a deep ache right at the end of your spine that gets worse when you sit or lean back, you're not alone. Tailbone pain, or what we medically call coccydynia, it is far more common than people realize. It's the kind of pain that makes simple things like working at your desk, driving, or even sitting down for a meal surprisingly difficult. Some describe it as a sharp jab every time they sit, others say it's a dull pressure that just refuses to go away. Hi, I'm Dr. Jayesh Bhanushali, and in today's video, we'll understand what causes this pain, how you can relieve it naturally at home, and when it's time to see a doctor. Let's start with what's actually happening. Your tailbone or coccyx is a small triangular bone at the bottom of your spine where your body meets the seat when you sit down. It's what we call a vestigial bone, meaning it's a leftover bone from our evolutionary ancestors who all had tails. Even though it's small, it plays an important role. It helps stabilize your posture and provides attachment points for ligaments and pelvic muscles. Now, this area can become painful for a couple of reasons. The most common one is a fall, like slipping on the floor or landing hard on your butts can directly injure the coccyx. Another common reason is prolonged sitting on harder surfaces, especially for people with desk jobs, drivers, or students. In women, childbirth can sometimes strain the coccyx as the pelvis widens during the delivery. And in some people, the tailbone is naturally more curved inward, which makes it prone to friction and inflammation even without injury. The pain can be frustrating because it flares up every time you sit. You may notice that standing or lying down feels better, but sitting straight becomes almost an impossible task after a few minutes. Now let's talk about what actually helps. The first and most important step is to reduce pressure on the tailbone when you sit. That means no hard chairs. Use a soft cushion or a donut shaped seat, something with a cutout in the middle. This allows your coccyx to stay suspended without direct pressure. If you don't have one, you can even roll a small towel and place it under your thighs when you sit, keeping your tailbone slightly lifted. The second thing is to correct your sitting posture. Leaning slightly forward and letting your weight rest on your thighs instead directly on the tailbone. Avoid slouching or sitting with your back rounded. Third, warm sitz baths can really help. Fill a tub of warm water, add a pinch of salt or alum, we also call it fit curry, and sit in it for 10 to 15 minutes once or twice a day. This improves blood circulation and relaxes the inflamed tissues around the coccyx. Fourth, gentle strengthening exercises. One simple exercise is the glute squeeze. Lie down on your back, tighten your buttock muscles, hold for a good 4 or 5 seconds and relax. Repeat it over 10 times, at least twice a day. Another is the pelvic tilt. Lie on your back, bend the knees, press your lower back gently into the floor, hold and release. These small movements improve muscle tone, take pressure off the tailbone, and finally, avoid prolonged sitting whenever possible. Take short standing breaks every 30 to 40 minutes if you have a desk job. Most cases of tailbone pain improve within a few weeks with these simple measures. But if the pain continues for more than a month, or if it's affecting your sleep, daily activities, your quality of life, it's important to get evaluated. Sometimes an X-ray or MRI may be necessary to rule out a fracture or a dislocation or simple inflammation. In all those cases, your doctor may suggest targeted physio or a local injection to alleviate the symptoms. So remember, tailbone pain is common but very much treatable, and all you need is patience, proper sitting habits, and a little self-care. If you found this video helpful, don't forget to like, share, and subscribe. And if you know someone struggling with a tailbone pain or coccydynia as we call it, share this with them. It might just help them sit comfortably again.